My name is Dr. Y. Venkatesh, Senior Consultant Neuro and Spine Surgeon, Kim Sunshine Hospitals, Hyderabad. Today I am going to talk about the latest advances in lumbar disc surgeries. All of you know that the lumbar disc problems come with symptoms of low backache and radiation of the pain to the lower limbs, sometimes numbness, sometimes some paresthesias, means abnormal sensations, and sometimes it could be acute or a chronic issue. Sometimes the pain will suddenly start when somebody lifts a very heavy weight and there is a disc prolapse. So once the symptoms are there and the pain is very severe, when the patient approaches us, a doctor, we would analyze his problem and then we come to a conclusion that it is a lumbar disc problem. So an MRI scan is done and we find that there is a lumbar disc prolapse or an extrusion which is compressing on the nerve roots or the nerves, which are getting inflamed and causing severe pain, numbness, and sometimes even motor symptoms like foot drop and weakness of the foot. So these kind of problems can be treated with different methods. Earlier days, we used to do what is called as a laminectomy and discectomy. That is a very invasive procedure where the upper level and the lower level of the vertebral body, this laminae, that is part of the vertebral body, used to be exposed, and then we used to remove the bone, the entire bone, called the lamina. There is a solid bone in front and there is a ring-like structure at the back through which the nerves go through or the spinal cord goes through. So we used to remove the entire lamina and upper level and lower level lamina. Then we used to go and retract the nerve root which is there in front of that, and then behind that the disc is compressing on the nerve. So that disc we used to remove. So in 1984, it was a great surgeon by name Yasar Gill who gave this procedure with a minimally invasive procedure, what is called a microdiscectomy. Otherwise, it used to be done without a microscope and a very large incision, about sometimes 5 to 6 inches of the incision, and a lot of muscle and everything used to be separated from the bones. The bones used to be removed completely. The bone, that is the laminae, the ring-like structure which is there behind the nerve roots, nerves, used to be removed, and then to reach the disc, we used to retract the nerve root and go to the disc and remove the disc which was offending the nerve. Now, since 1984, this new procedure called microdiscectomy was introduced into the neurosurgical practice, and here the bone is not removed at all, or only a little bit of the bone is removed to get the access into the area where we can remove the disc. That is called the microdiscectomy, and here we have an incision of about 1 to 1.5 centimeters, sometimes maximum about 1 inch, and through that incision we can go in and identify the structures, the upper lamina, that is the upper ring, and the lower ring of the bone. Between these two we work and we go to the nerve root and we separate the nerve root from the disc and remove the disc. So this procedure is a minimally invasive procedure, and we can and the results are excellent. The post-operative pain is very minimal, and many times we do the surgery in the morning and the patient is up and about by evening, and many times we even discharge in the evening, sometimes the next day morning, depending on the operative pain. The next advance which has come in is the endoscopic surgery, spinal endoscopic surgery. Here also we have got different types of endoscopes, different manufacturers, and the philosophy behind the spine surgery is that we should go to the pathology, that is the disease. The disease is the lumbar disc. We go to the lumbar disc area without actually disturbing the surrounding structures. That is the way we treat this. So in endoscopic procedure, there are two types of endoscopes, where one endoscope uses an incision of about 1.5 to 2 centimeters. The other endoscopes use about 6 to 8 millimeters incision, and there are two different methods of doing this, and both these endoscopic techniques give excellent results without actually causing any disturbance of the normal structures. So as we advance in our neurosurgical practice or any other surgeries, the The philosophy behind the present day knowledge and surgery and surgical technique is that we should not cause any damage to the normal structures. We should only remove the offending disc or any offending pathology. That's how the surgeries of laparoscopy in the abdomen and other procedures have come in, minimally invasive procedures. In spine, especially lumbar disc surgery, we have an excellent procedure called an endoscopic discectomy procedure, which is very minimally invasive, and the patient can go home within 4 hours after the procedure, and it can be done under local anesthesia without any major general anesthesia and such things.